Hello, everyone. Good morning. For us to get started with our first session of the year 2022. Thrilled to have Dr. Nidia Messias here with us. She's an associate professor of pathology at Washington University School of Medicine in St. Louis.
So the title of my talk is actually digging deeper in renal pathology. I think working with Helen Liapis made me a better gardener. So let's dig deep today. And people might be wondering, so what is this really about, since we're not really gardeners here? You might have noticed it or not by my accent and by my origins that English is not my first language. And I like to start things trying to really know what they are. So to dig deep, I went to the dictionary to start. And if you dig deep, you do a very thorough investigation into something. The definitions of that expression says that you make a lot of effort with all one's resources. An example that I put into the dictionary is that if you want to join the Marines, you really have to dig deep. You might, like me, feel that there are other examples that you can use that phrase. If you want to be a doctor, you have to dig deeper. And this is what doctors do. We are physicians, all of us, and for the benefit of our patients, we want to use all of our resources. And we every day do deep through investigations. We do that in pathology as well. And one of the reasons why we do that is because the art and science of medicine involves a lot of curiosity. This is the WashU magazine, and the curiosity is in the name. And this is what we are fulfilled and obligated to do as doctors. But if you talk about pathology, we're going to have to meet the doctors. Pathologists are the ones that go up to the cellular level to try to explain, understand disease, and give a diagnosis that is both accurate and that is going to eventually help you to do the treatment and help the patient. So among the pathologists, I chose this specialty of renal pathology. And in renal pathology, the digging deeper really goes on and on, because renal pathology is a specialty that by nature already uses a lot of different techniques. We have to use clinical history to start to do good integration, a light microscopy, as every pathologist do, but part and parcel of the renal pathology diagnosis is also the use of immunofluorescence and electron microscopy, which are sophisticated techniques to eventually reach the diagnosis. And this is the reason why everybody loves renal pathology, because it's that simple to get to the diagnosis. But that was renal pathology, as we classically were used to think of it. Renal pathology has, especially over the past years, a few years, really expanded. So the layers of the diagnosis nowadays, they are not limited to the immunofluorescence and the electron microscopy, the light and the clinical history. To get to the diagnosis, actually, we can use several different tools depending on the variety of diseases. And I hope that those tools are going to increase and we're going to be able to give more accurate diagnosis, more specific diagnosis, and reach diagnoses that are going to be more helpful to hopefully also much more specific therapy. So my goal in this talk is to talk to one of those techniques, that is paraffin immunofluorescence. That is a tool that we can do more than what we usually do in renal pathology, and use it as an example of what should be the current approach to the renal biopsy. So when we dig deep in renal pathology, what we really want to do is improve patient care. I'm going to show you through paraffin immunofluorescence that when we use this approach of digging deeper, we can limit our limitations, we can unmask what is unseen, and we can overall broaden our knowledge. I'm going to use a series of cases to try to convince you of that. So on case number one, how can we limit our limitations? The clinical history was of a patient that was a young female, 26-year-old. She had non-nephrotic range proteinuria of 1.3 grams, some hematuria as well. mildly elevated creatinine at 1.3 and a positive ANA, low positive at 1 to 80. She also had a history of hypertension and obesity, and for that, proteinuria and hematuria, she was biopsied. We got the renal biopsy. It was a great